Hi, Mark here from Weedwell, and thank you for joining me for my daily topic of the day. When considering introducing cannabis to your treatment plan, it is prudent and advisable to discuss it with your doctor whenever possible. There are many reasons your healthcare provider should be aware of your cannabis use. At the top of the list is possible drug interactions. Both CBD and THC have the potential to interact with some medications like antidepressants, blood thinners, and even some cancer medicines. Interactions should not be taken lightly. Some drug interactions can actually cause serious medical consequences. Now, that said, marijuana has been safely used to treat a multitude of conditions ranging from arthritis, chronic pain, insomnia, and seizures. At Weedwell, we strongly support a team based approach to care and encourage all our clients to be fully transparent with their physicians about their medical and recreational cannabis use. So, why not talk to your doctor, you may ask? Some patients find it challenging to start this discussion. The most common reason is my doctor doesn't believe in cannabis. Well, one reason that doctors have difficulty with cannabis is that they have not learned about cannabis in medical school. Now, that's understandable since the endocannabinoid system, that's the cannabinoid receptors in your body, was not discovered until the 1990s. Some doctors may have trouble supporting the use of cannabis because current evidence is not of the highest scientific quality. And doctors look for high quality evidence for any treatments that they prescribe. The good news is that with legalization in some countries, more and more studies are being done. There is new evidence daily for the safety and effectiveness of cannabis. Now, this leads us to the final reason why some doctors find it hard to prescribe cannabis. And you may have guessed it, stigma. That's right, stigma. So, how should you talk to your doctor about medical cannabis? You may be wondering. First and foremost, be transparent. If you have tried cannabis for your medical condition and found it to be helpful, share this experience with your doctor. Try something like this. Doctor, I'm wondering if I can talk to you about something that has helped me with my condition. An approach like this is relatively non threatening, and your doctor will likely want to hear more. And tell your doctor about things that you have tried that had side effects or were not helpful. Finally, explain to your doctor how you came about trying cannabis for your medical problem and how it has helped you. Doctors need to hear stories like this from their patients. You have the power to change your doctor's opinion by sharing your own experience. Now, for those of you who have never used cannabis, it is also important to share with your doctors the treatments that you've tried and how you came to consider cannabis for your condition. Maybe you have a friend or a loved one with a similar problem that has found success. Perhaps you read an article about how cannabis could be helpful. But remember, the more scientific your information is, the more likely your doctor will be to accept this as legitimate. Now, a word of caution, do not try this approach and say, it is natural, it must be safe. This is a statement that your doctor will unlikely want to support. Why? Here's why. Tobacco, cocaine, alcohol, and opium are all natural substances. Although there are many safe and gentle natural products, To your doctor, natural simply does not mean safe. So, if all else fails, what's next? So, if you are not able to obtain the support you need from your doctor, consider seeing a doctor who is familiar with CBD and THC. There's a growing number of physicians who understand the current state of treatments, evidence, dosing, and interactions. Consider asking for communication, though, between your cannabis doctor and your physician. This should include the assessments along with the treatment plan and a review of any potential medication interactions. After you've had a chance to trial the medicine, follow up with your doctor. Let your physician know about any side effects, if any, and then tell him or her about how cannabis has helped or not. More and more doctors hear from their patients about medical cannabis every single day. This is increasing their knowledge level, and makes them better equipped to help others. So, for more on this topic and to access valuable resources, I encourage you to go to weedwell.co/map9. So MAP is MAP 9. Let me repeat that. weedwell.co/map9. Or you could simply send us a secure text to 705-805-8264, then hashtag MAP9. One more time, 705-805-8264, hashtag MAP9. Now, for your convenience, I have included these links in the description section of this post. In conclusion, I'd like to share this manifesto with you. It goes like this. Doctors have my best interest in mind. Now, sometimes they seek alternatives because I have not responded to the primary treatments. I'll let you ponder over that. And as always, I do look forward to the next time that we connect. And until then, be well.